Here we go. All right, so our fall prevention program is, wow, falls are just really something that all of us are really passionate about getting the information out and helping everyone to prevent falls because many falls and most falls can be prevented, and you have the power to reduce that risk of injury or death. And fortunately, we have some great sponsors in this. Both Villages of Santa Fe is producing this, and it's hosted and sponsored by Krista St. Vincent's and AARP of New Mexico. Villages has a number of programs in our wellness series, but our main program is we provide age-appropriate live and in-person exercise programs focusing on balance, strength, flexibility, and all the things that are critical for fall prevention. If you go to our site, you can see our upcoming schedule. We do, like I said, have free classes coming up on Friday. Our next wellness seminar will be in March, and that'll be emergency to urgent care. It'll let you know the difference between what to expect at emergency departments versus urgent care and when to select one of those or the other. Your presenters today, myself, I'm the founder of Villages of Santa Fe, and that's my new grandson, which we're having lots of fun with. Katie Titus is wonderful. She's the clinical supervisor, inpatient rehab therapy at our hospital here, Krista St. Vincent's Regional Medical Center. And of course, Maria Francis, I know many of you take classes with her. She's a founding member also of Villages, and she also teaches Matter of Balance and On the Move as a master trainer. So, this workshop is, tell you what's going to happen today. So we're going to talk about reducing the fear of falling and increasing your activity levels. So falling is a vicious cycle. What are the myths about falling? Fall statistics, that's one we get to scare you about. Bad habits that increase your chance of falling. What causes falls? What actually causes falls? What is your risk level? And what to do if you fall. And then this is about 90 minutes and with Q&A during and after the program. So we'll let you know when we have a break when you can jump in and ask questions. Exercise and other function factors to reduce your risk. The importance of exercise. According to the CDC, the only way to prevent falls is to exercise. We talk about ways to be active, the 4 types of physical activity: endurance, strength, balance, and flexibility. What are your barriers? What is stopping you from exercising? Safety tips when you are exercising. And then there are other causes of falls: medication, vision, hearing, and nutrition. And then we'll talk about our home safety and gadgets for better living. So Maria, I think this is yours.
Okay, so falls with or without injury carries a heavy impact on quality of life. So older adults may fear falling as a result limited their activities and social engagement. We're going to talk about a little bit about that later. So according to the CDC, more than 1 out of 4 Americans age 65 falls annually. So far, falls are the leading cause of fatal and non-fatal injuries among older adults. So we talked about falls is a vicious cycle. Since all the years that Ann and I have been teaching this class and talked to people that have had falls in the past, and this is pretty typical. So people that fall, so patients who are hospitalized for a fall-related injury, 35% will be readmitted for fall-related injury, and 5% will die within a month. This is studies done in 2022 by Krista St. Vincent here in Santa Fe, is a community health needs assessment. So if you look at this chart, so you develop that fear of fall. Okay, you have a fall, you develop fear of fall. So what usually people do, they decrease their activity. So they stop exercising, they limited their socialization. So by limiting exercising, or even for a walk, or going out or doing anything, so you reduce your muscle strength, your balance in your gait, and your flexibility. So your body start becoming very weak. And we'll talk about this later. So as we age, we lose not just strength in our muscles, but we also lose power, the ability to really stop if you have, if you lose your balance, and kind of regain your balance back. So also decrease your functional ability. This is all by reducing your muscle strength, your muscle power, your socialization. Then what happened? You fall again. So the chances of people falling after the first falls increases tremendously. So very important to continue activity and exercise. Okay.
So there are a lot of myths of falling, and number one is it happens to other people, not me. I don't know if y'all have noticed, but probably if you've gone in for your annual checkup, one of the questions your doctor or primary care physician or PA is asking you, have you fallen recently? It happens, it just does. And but it's not normal. Sometimes people think it always happens as you get older, but that is not necessarily true. So if I limit my activity, I won't fall. And as long as I stay home, I can avoid falling. I think, Maria, you can talk about that percentage of people at home falling.
Yeah, that's 35. Yeah, that's not 25%. That's people that stay home. Yeah. So what do we are, Han? Which one? That's number 3.
Yeah.
Okay. So so people that believe that they stay home prevent falls, it's not true. Performing physical activity is very, very important to keep you independent. So your strength, your range of motion benefits from you to remain active. So social activities are also good for your overall health. And the statistics shows that 25% of the people, the falls happens at your own home. So that's very important. So the next one is, as long as I stay home, that's just part of it, okay? Overall, falls take place at home. Then we're gonna talk about later risk falls at home caused by things that we have around our house, that we're gonna give you a checklist about things to watch for. So hazard things like phone cords and different things, rugs, clutter, poor lighting, a lot of things. We're going to talk about that. Modifications that you can do at home, like adding grab bars in the bathrooms and second handrail, stairs, all those things help to avoid falls.
And as Katie mentioned, so many falls happen in the bathroom as well. So we'll talk about safety in the bathroom.
Yeah. So we talk about the muscle strength and flexibility can be regained. That's not true. So as you exercise, I'm not saying that you're going to go back where you used to be when you're younger, but you stop losing more and also increase. So partially restore this strength and flexibility. So it's never too late to start an exercise program. If you haven't been a couch potato all your life, so you are becoming active now, benefits you in many ways, including protection from falls. So we basically tell people all the time, keep moving, whatever you do, do something, even if it's just walking. Okay, what else?
So myth number 6, we're going to discuss this much later too. Taking medication doesn't increase my risk of falling. But medication frequently, if you look at the side effects on medications, just look at statins. How many people take statins? The second or third drug interaction, or not interaction, but maybe falling, dizziness, fainting, or whatever. So we'll talk about later, when you ever have a change in your medication, it goes up, it goes down, they change the type of medication. Be sure to not only talk to your doctor and the pharmacist about what could be the side effects, but also interactions with other drugs you might be taking. Do not neglect to talk about your over-the-counter drugs as well. We'll speak about that later. Myth number 7, I don't need to get my vision checked every year. Again, we'll talk about that later, but I think the easiest thing to demonstrate that is try and stand on one leg and close your eyes and see how hard that is. Vision means a lot to your ability to maintain your balance. Using a cane or walker will make me more dependent. Not in any way, shape, or form. It makes you more independent. It makes you more confident in your walking. We live in Santa Fe, which is a very outdoors environment community, and frequently I'll see people walking around towns with walking poles, the hiking poles. So they understand they may need some extra support, but instead of using, they don't need a regular walker per se, but they need some stability. So these walking sticks can really help, and we'll talk about how to use those later.
Importance of communication. I don't need to talk to my family members or my healthcare provider if I'm concerned about my risk of falls, and I don't want to alarm them. I want to keep my independence. So basically what we tell people is, and this is true, this is fall prevention, it's a family affair. It's a group of people between your doctors and your family that keep you safe. So it's very important to share with them, because they want to help you. They want to support you. They're not going to take your independence away if you feel like you still can do things. And we hear this all the time. People keep it to themselves. So it's a group effort here. So share as much as you can with friends and with your doctor and with your family, what your fears are and what's going on with you. So we always promote that.
So national statistics, and this is where Villages happens to be on the Community Health Needs Assessment Committee with Chris of St. Vincent's, and we're always looking at the safety and well-being of different age levels in the community. So we are obviously on the older community health needs assessment. And unintentional falls are the leading cause of injury and injury death among older adults age 65 and older in the US and in New Mexico. And in New Mexico, because we are here, we follow the statistics here, it's even higher. It is going down somewhat, but it's almost 20% higher than the national average. $50 billion is spent on medical costs. And that's just the medical costs. That doesn't count the resources that the family and you take if you take that in consideration, the time and effort and just the mental strain that it takes to recover from falls. And many falls are preventable. And falls are the most common cause of older adult TBIs, traumatic brain injuries, accounting for over 46% of fatal falls. And Katie's going to talk about that issue and statistic later on, that when you fall and you hit your head, what to do.
Okay, this is falls in New Mexico. So in New Mexico is 1 in 3 older adults instead of 1 in 4 to the United States. So this is 100, and the 2022 information, we had 123,000, almost 124,000 falls, 33%. Older adults reporting falling during the previous year in New Mexico. So if you take a look on the scale, male is 33.1 and female is 33.7. So also a statistic shows as the age after fall, after 80, 85 up, your chances increases dramatically. So we see a huge increase on that age group.
Sorry about that.
That's okay. I think we're on that one.
Okay, all right, there you go.
Okay, so now it's going to talk about what causes falls. What's the most common things on falls. So balance is also provoked by balance. You lose your balance, you will not be able to regain. So balance problems and disorders. So balance is a combination of three systems: vision, proprioception, or awareness of the position, movement of the body. Basically, the proprioception is more of the brain function communicating with your muscles. Vestibular, relating to vestibule, particularly the inner ear, and more generally the sense of balance. So people with, like, let's talk about the vision. People with cataracts, muscular degeneration, stroke, poor lighting, blurred vision, changing light. Okay, those are the typical things that affect vision. The proprioception, like people neuropathy, lumbar spine injuries result from sensation on lower legs, surgeries in ankles and or knee, people with vertigo. Vertigo is more related to the vestibular, vertigo, also stroke can provoke that. So also another thing that I talked about earlier was the decrease in muscular power. So the power is a force produced in a given amount of time. So muscle power declines earlier and faster with aging versus strength and endurance. So an early indication of balancing deficit or fall risk, even in non-frail adults. So they had done a study on people that had falls, and the majority of them, and from people that didn't have their falls, they had an analysis done. They showed that people had falls had a very dramatic reduction of muscle power besides the muscle strength. So this is something that I work in my classes all the time, and I talk about. I teach you how to do exercise to work on that power of the muscle. Okay, I think we're done that, Anne. Okay, so continue down balance problems and disorders. So do I have a balance problem? So questions to ask yourself. Do I feel unsteady? Do I feel like the room is spinning around me, even only for a brief periods of time? Do I lose my balance or I fall? Do I feel I'm falling? So let's things that you gotta pay attention to. Do I feel lightheaded? Or I might feel like I'm gonna faint? Does my vision become blurred? So those are the things that we ask people to really pay attention to. So assessing now risk. Now I think we're gonna move into Katie. How you assess your risk? Do I have a problem? That's the thing we will need to talk about it now.
Yeah, so we want to welcome Katie Titus. We've been working with her I met her a few years ago, and we really had just a bang up program this last September. We partnered with Krista St. Vincent's, and Katie was the go-to person. She designed the whole program, and we had a falls-free checkup at this hospital. And we had over 130 people come in and take all these different risk assessments. And Maria was teaching classes, and we had an audiologist, we had the pharmacist, we had the neurologist there. We had so many people there helping people understand falls. So Katie, thank you for putting all of this together and being here today. And so she'll lead off with what are some of the different risk assessments you can take.
Thank you, Anne. Thank you, Maria, for having me. Happy to be here. So all of the fall risk assessments that we do at our annual Falls Free Checkup are based on the CDC's STEADY program. STEADY stands for Stopping Elderly Adult Deaths and Injuries, and it's mostly related to fall prevention. So all of these are standardized assessments that we can do to assess what might make you more likely to fall. So the first one we're going to talk about is orthostatic hypotension, which is also known as postural hypotension. So the way this is assessed is checking your blood pressure after you've been lying down for at least 5 minutes, and then checking it in standing within 1 minute, and checking it again after 3 minutes of standing. So orthostatic hypotension is the drop in blood pressure with position changes. So the top number, the systolic number, we're looking for a 20-point drop. And the bottom number, also known as the diastolic number, we're looking for a 10-point drop. So what you might experience if you have orthostatic hypotension is a feeling of being faint, hot or sweaty, nauseous, and this can cause people to actually pass out and fall. So it's a really important indicator of what might make you predisposed to fainting. And the way that we treat that is either talking to your doctor or pharmacist about medications that you're taking that might cause this. A lot of blood pressure medications can cause this. And if it's something that you can't change with your medication, then the treatment is to try to increase your blood pressure after you change positions. So that might involve kind of leaning forward onto your stomach to try to increase your abdomen pressure. It might include some exercises and sitting before you stand up. Certainly just sitting for a moment to see how you feel before you get up and walk away from the bed right away. But again, this is an assessment that you can do at your doctor's office. If you have a blood pressure cuff at home, this is something you could do on your own. And if you're available next September or this coming September, we'll be doing this at Christus St. Vincent in Santa Fe as well. So the next part of the battery for balance assessments is the 4-stage balance test. So this test is looking at 4 different positions maintained for 10 seconds each without holding on to something. So the first position is with your feet touching side by side. If you can hold that for 10 seconds, the next position is sliding 1 foot halfway forward. And the next position is feet heel to toe, like you're walking on a tightrope. If you can get through those 3 positions for 10 seconds each, you're considered a lower risk for falling. And the final position of the 4-stage balance test is standing on 1 leg. So if you can do all 4, you're in really good shape. If you can do the first 3, you're at a lower risk for falling. So all of these tests can also be used as exercises. So you could be doing this as an exercise or as a balance training program at home. We always recommend you do it next to something sturdy like your kitchen counter. But all of these tests are available on the CDC's website. If you just type in STEADI study, it'll come up with all of these handouts. So you're welcome to download those from the CDC's website. Next is the timed up and go. So this test is looking at your power, like Maria was talking about, to get up out of a chair, walk 10 feet, turn around and come back. So we're looking for, we're timing this as you do it. And I believe there are age matched norms for this test. No, I'm sorry, it's 12 seconds. 12 seconds is the cutoff. So if you can stand up from a chair, walk 10 feet, turn around, come down and sit in 12 seconds or less, you're at a lower risk for falling. So this one is the one with age matched norms and gender matched norms. So we're going to turn this into some audience participation. So everybody, if you're sitting in a chair that you can easily get out of, I'd like for you to get ready to do some exercise with us. We're going to actually try this test. So the goal of this test is to stand up with your arms across your chest, stand all the way up, sit back down as many times as you can in 30 seconds. So I'm going to try to wake you up mid-presentation here. So I'm going to give everybody just a few seconds to get set up here. Adjust your chairs if needed. And on the count of 3, we're going to get ready to stand up and sit down for 30 seconds. 3, 2, 1, go.
Chair.
Yeah, 5 seconds left. And done. Good job, everybody. That's my timer. Okay.
Hey, Katie, that's the typical deal. Do not do this with a chair with wheels. I kept on going backwards.
That's right. Yeah. If you have a sturdy chair with armrests, just in case you need them, ideally, and especially a chair that doesn't slide around. Woo, I'm out of breath. Okay. So y'all got a little blood pumping. So again, on the right column of this page, you'll see age groups 60 to 64, all the way down to 90 to 94. And your goal is to beat that number of repetitions of sit to stand in 30 seconds based on your gender. And again, turn it into an exercise if you're struggling with it.
It is. And Katie, do you do those at the hospital when you're evaluating?
All the time. All the time. Yep.
And we will have these tomorrow. I'll have this video up, and we'll also have these you can download if you'd like to download those. Certainly, the sit to stand is very easy to take personally. Mm-hmm. We actually ask people to go ahead and do that. If you're starting an exercise program, do it and see how you're improving.
Yeah, they can also, and people can share in their chat how the numbers they got. Like Debbie said, woohoo, she beat it. So just to give you a base, that's what you are at this moment. So you can increase that. Yeah, Shayla got 16. Great. Yeah, look your age group and in that list here. Yeah, 10. Joyce did 10. That's great. Oh gosh, 69 for Debbie. She's 15. Wonderful. Yeah, 16, 15 for Margaret, 12 for Andrea. Yeah, Gailey 72, she did 20. Whoa, that's wonderful. Way up there. Eugene did 13. Yeah, that's great. Gailey was in my age group. Joyce, here she's 80. She did 10. Great, Joyce. Wonderful. Yeah, I do this sometimes on my classes on Monday. I do this exercise for people just to, to see what they are. And as we progress, we can do them again. So wonderful.
It's a great thing to share. I mean, it's really kind of fun. I just like, okay, how are you doing? And you say, well, when I first started this, I was, especially at the end of 30 seconds, I was really out of breath, but now I do 30 seconds and maybe I'm not as far as I really want to be, but I'm not nearly out of breath. So my exercise is helping. Yeah.
Good. And Anna she's 71. She did 16. Wonderful. Okay. Perfect.
Good job, everybody. Okay, so we already discussed the fact that falling can be a vicious cycle. So this is a question we ask every patient who comes to our inpatient rehab unit. Have you fallen in the past 12 months? If you did, were you injured? Do you have any fear that it might happen again? All of those things perpetuate that cycle of falling. And you want to talk to your doctor about it as well as your family, because we need to figure out what sort of assessments we need to do to figure out why you're falling and what we can do to reduce your risk of falling again.
I believe in New Mexico now, I'm not sure about the other states, but falls with injury have to be reported to the health department. Is that correct?
That's correct.
Yeah.
Okay, so there's a lot of debate about what we can actually do to reduce our risk of injury while we're falling. There are a lot of things that we can do to improve our ability to catch ourselves, reduce the frequency of falls. Whether or not we have the ability to really think about how we're falling in real time and make a correction to it is a little bit up for debate. But we do know that the more fit you are, the more in tune with where your body is in space you are, the more likely you're able to either catch yourself from falling or fall in a way that reduces your risk of injury. So let's talk about what those tips are. So people who are really rigid when they fall tend to fall just on one spot. And so it makes them more likely to hurt just that one area. So if you feel like you're falling, your goal is to get closer to the ground, but also not to get super rigid, which is hard to do because most of our reaction when something scary is happening is to tense up. We're going to talk a little bit about traumatic brain injuries in the next slide. We want to try to protect our head. It's the most important part of our body when it comes to the severity of injury when we fall. So if you are falling to the left, our reaction is to look to the left to see what we might fall on. If you know you're going down, the goal is to protect your head. So look in the opposite direction of where you're falling. We want to try to distribute the force among the most meaty parts of our body. So not our bony prominences, because we're more likely to break a bone, but your butt would be a great thing to fall on. Doesn't mean you're gonna not end up with a fracture, but you've got more meat there typically than other parts of your body. You can also think about trying to distribute the force. And one way you can do that is to keep falling. So if you really, have the wherewithal to say, this is happening, I'm going down, don't try to stop yourself as soon as you hit the ground. Try to keep falling. You could even kind of slap the ground or roll as you're falling so that you distribute the force on more parts of your body. So traumatic brain injuries usually result from landing directly on your head in a car accident. And traumatic brain injury can also result from like a whiplash. If you fall and you have any inkling that you've hit your head, even if you're not totally sure, it's really important to go get it checked out. So you're going to want to go to the emergency room, probably not urgent care, probably the emergency room, because we need to make sure that you haven't had an injury to your brain. Next slide. So this is just a couple of images of what can happen to your brain when you fall. So the second one is what I was talking about with a whiplash. So even if you don't hit your head directly, if you have enough force that your head is sort of ricocheting, your brain can actually slide within your cranium and bump into your skull and cause the same kind of injury if you actually directly hit your head. So all of those concussion symptoms listed at the bottom are things that you want to look out for about 2 weeks. So a lot of people think, okay, I hit my head, 2 days later, I was fine, I'm good. I've seen people come back to the hospital 2 weeks later with some of these symptoms, and they actually have a bleed in their brain that needs to be addressed by our emergency room personnel. So have your family be looking out for some of these as well if you think you've hit your head after a fall, because symptoms can sort of have a delayed reaction. So any of those things you might see for up to 2 weeks after a fall, or potentially even slightly longer.
Yeah, I just want to reiterate that because it's just, you fall and you hit your head and, none of us want to go to the emergency department. No, we don't want to go. But the reality is, this is one of those injuries you cannot predict on your own. You cannot diagnose on your own in any way, shape, or form. The only way it can be done is by a medical professional and possibly either an MRI or a CT. So
Yeah.
please do just suck it up and go.
CT is usually what they'll do. That usually looks for blood or other fluid collection in your brain that would indicate that you've had a bleed somewhere in the space between your brain and the actual cranium. It's a quick and easy test. Just go get it done if you have any concern.
Okay, so let's talk about the bad habits. We all develop those as we go along the life, right? So we develop risk behaviors that increase our chance of falls. Follow these simple steps. I'm going to give you some ideas, and I want you to think about if you have done those, okay? So we're going to identify some personal behaviors patterns that place you at risk of falls. So then you're going to select your, the ones that you think it put you at greater risk, and you're gonna try to collect them. You're gonna try now. You're gonna correct them, stop doing them, and then gonna implement solutions to avoid potential dangerous situations. Okay, so let me give you, if you want to write this down, if you have a piece of paper, you can read, you can see this video again, or I'm going to do some of them. It's about 3 or 4 pages, but I'm not going to read all of them. I'm going to read some of them. Okay, one of them is, I take my time getting out of bed. Think about you. Every morning, do you just wake up and get out of bed? Don't sit and wait for the blood to flow back to your head? What kind of habit do you have? So think about that one, okay? I pay close attention to whatever I'm doing. This is a typical one. We just walk around. Some people walk around in the streets, watching their phone or doing something else, not paying attention to their surroundings. So this is a really one that it happens all the time. So what about you? What do you do? Do you pay attention? You I tell people, keep your head on your shoulders. Don't let your head go anyplace else. Okay, so I take it easy on those days when I don't feel like myself. Some days we don't feel that great. So I push it, take a break. Okay. What about you? Avoid walking on wet or slippery surface, or take other paths if it's necessary, especially during the snow time, times of the year that's raining or snowy. So make sure that you pay attention where you put your foot. Also, the dark room. Do I turn light when I enter a dark room? A lot of falls happen because it's changing the light and people don't see it, then trip on something on the floor. Okay, let me see what else I'm going to tell you. Another one. This is a big one. When I'm carrying things, I leave one arm free to hold on to rails or stable furniture for support, even though it's my way, mean twice the number of trips. This happens to people when they go shopping, okay? You have all those bags, people get out of the car, and they get those arms full of groceries, and one hand is not open for any accidents or anything that's going to happen. So make sure that one hand is always available. Anything that you carry, even going up the stairs, make sure that one hand is on the railing and the other hand is free. It's holding whatever you have going up. What else? I use my cane, walker, or the pieces of adaptive equipment as prescribed by my doctor therapist. We talked about that. So I'm just going to make this short. I'm not going to go long because the list is long. So those are the things that we hear that's more common. No flip-flops. Yeah, that's a good one too. So I used to wear flip-flops all the time. So flip-flops, it is a no. Okay, walk in your house with a closed toe and back end shoes, because flip-flops can cause serious health hazard by falling. Okay, so now we're going to take some questions and also share with us what is the one that you identified today or have in the past that you have changed or have an intention to change. So, Anne, can you stop sharing so we can talk?
Sure. There we go.
Okay, so who wants to talk? It's your time to share. Okay, unmute yourself. Let's see, I think you can unmute yourself. And you can, anything.
I'm going to share while we're waiting for somebody to stick their hand up. We have a really close relationship with everyone at Christa St. Vincent's.
Hi.
We
Hi.
use,
Hello, my name is Ruth. I like it very much, but I'm in a different situation. I'm an amputee on my leg. I had what Terry Fox had, so I lost my leg. You hear me?
yes,
And so I'm walking with a walker, but I walk very slowly, but I'm not falling. The doctor said it's okay. I'm walking okay, very slowly.
slow is good.
Yeah, because I don't want to fall.
Yeah.
And you know what? Like, you don't know my apartment. I was for six times I was in the hospital because I had a sickness bursitis. Mount Sinai straightened it all out. I was in severe pain. So I have between my bedroom and the kitchen a wheelchair which has pillows on it. So if I feel I can't walk that much, that distance, I sit on the wheelchair till I calm down.
Perfect.
You know what? You could fix up your apartment to your best ability. Nobody else can. So if I can't walk that, nobody else can do it. You can do it yourself. And so I have a wheelchair. So if I can't walk that much, I sit on the wheelchair till I gain back more strength.
Perfect, Ruth. I think it's great. Great.
And outside I can't walk far. I use my scooter.
Perfect. Yeah.
How could I don't fall?
Some comments, Lucian? Yeah.
I have a really bad habit of carrying too many things in my arms going up the steps, especially like to the second floor of our house. And sometimes I wear low mule shoes, and it was like, I don't think I can do that. I just have to not do that. But yeah, my husband's always saying, you can make more than one trip. But it's like, I'll pile all these things on top of each other. So I'm trying to be more cognizant of that and just make more trips, which are good for me anyway. Do more steps. So yes.
Great. Thanks for sharing, Regina. I think it's great. Leave the hand open. Yeah. Joyce, Joyce say something? Joyce,
yes, I do 3,000 steps 3 times a week. I also do the exercise with Maria and with the yoga twice a week or when they're on. So that's how I get in my steps, 3,000 steps in the house. I don't go out. I can do it inside rather than going outside. 3 times a week.
That's wonderful. Yeah. Okay. Well, thanks for Joyce for sharing. Anybody else? Somebody else says, Pam said that her biggest problem is when I step to the side. I don't know what that means. Can you say a little bit more? I don't know. Maybe I'm not understanding the step to the side.
So, like I'm doing dishes, and I do them by hand. I don't use a dishwasher. And
Okay.
I step to the side to grab something or to put, and I find that that's when I have to catch myself, is my feet catch somehow when I'm stepping to the side. You know, reaching, you know, like moving literally laterally.
Okay.
Katie,
Yeah.
do you want to, is there anything you can say to address that?
Yeah, absolutely. So it sounds like you might, of those 3 balance systems that contribute to your awareness of balance, it sounds like proprioception might be a challenge for you. So knowing where your feet are, and this is a common problem. So the way that you work on it is just to practice it in a safe environment. So it might require seeing a physical therapist if you're feeling like you're not safe enough to practice that on your own. Or a personal trainer at a gym may be able to help with that. And then in terms of more of the muscle strength, you might need to work on strengthening the muscles on the outsides of your hips that actually help take larger steps so your feet don't get tangled up when you're stepping sideways.
Okay, thank you.
You're welcome.
Thank you, Pam. Who else? Anybody else? Yeah, nobody else?
Hello.
Okay.
My name is Ruth. You hear me?
Yeah, Ruth, you already shared. Is that okay if we move on? Because we have a lot of people here. You already
Oh,
shared.
my name is Ruth. Can I just say something? I want to thank Circle of Care very much. I was 6 times in a hospital until they found out the problem. I was in severe pains with bursitis, and now I'm getting help, except for Mondays, 2 hours per day. So they make it they come in and check how I'm doing, and whatever I need done here, they do for me. So I don't have so much responsibility at home.
Okay, that's great. That's wonderful. Thanks for sharing.
I still volunteer at Bake Fest on Mondays.
Okay, great. Keep it active. That's what we say.
Yeah, keeping my mind active and the body.
Great. Okay, we're going to move on. Okay, thank you so much. Let me see, somebody else here said something. Kathy G, do you want to say something?
Yes, I found that going to the Y and doing water aerobics or yoga in the water has really helped me get stronger.
Mm-hmm. Yeah.
And I didn't know if, you know, any of these other ladies could do that, because in the water, it takes all of the tension off of your knees and your feet. So it really does help.
And also, Kathy, if you fall, you're just in the water.
Right. We laugh a lot.
Yeah.
I
Yeah.
belong to a group called the Aquadorables.
It's a good one. Thank you, Kathy, for sharing that. Pauline had a question. It seems like to me, Katie, that she has problem with her vision, because she says she cannot see curbs, so she has to be very careful with the curbs.
Yeah,
They
so
see closer.
vision can be part of the equation. And also, if you have really good proprioception, you automatically can sense how high you need to pick up your foot. And your body can make changes in real time. If you feel like you're starting to catch your toes, your foot will lift up a little higher. So if that system isn't working properly, and especially if your vision is impaired too, both of those systems may be contributing to your risk for falls.
Yeah. Okay. Another question is, Sherry has a question. What are your thoughts on zero balance shoes, traditional versus traditional tennis shoes? I don't know. Are you familiar with the zero balance shoes?
Is that the shoe with kind of the rocker bottom?
Sherry, you there? I don't know.
Yeah, it's straight across. When I went to get my yearly shoes, I usually get tennis shoes with the inserts anyway. And so I had seen different articles on these zero balance shoes. So this year when I went, I specifically asked about it because my son lives in very hilly terrain. And I had just ordered some off Amazon, and I was very surprised how much an easier time I had walking in his yard. And so I'd asked one person about it, and they were kind of like, nah. And then I asked somebody else about it, and they were like, they felt the sole was straight across. I'm trying to think. It's straight across versus when you look at your tennis shoes, I tend to get tangled, my feet get tangled up with traditional tennis shoes. And so they were suggesting zero balance, but they're kind of pricey. Well, they're comparable to traditional high dollar, running shoes and stuff. But I wasn't quite sure before I laid out that kind of money. So I was trying to get just different opinions on them.
Yeah, I haven't heard of those, but I'll do a little research. I'm a good multitasker. I'll see if I can find anything and put it in the chat.
Let me see. Yeah, I never heard of them either. That's a good thing to know. Thanks for the tips, Sherry, for telling us that. I had no idea. That's something that we can tell people if we know that works. See, it really helps when a cane goes first and helps. Yeah, Anne is talking about canes using when she feels. Also, Anne and I talked about when you go to walking, you can walk using walking stickers, sticks, right?
Right.
And
Yeah.
that helps you with, especially in areas that's a bit difficult to walk. So that's another option too, besides the cane. Yeah, so that's good. Okay. Zero drop is no, okay. Okay, so while Katie does this research for us on the shoe, is he done with her part, Ann?
Yeah.
Okay, we're gonna move on, guys, so we don't be late.
So we're going to talk now about the importance of exercise, because it's really a life-saving strategy. Again, there's no pill, there's no building, there's no anything to prevent falling. It's just really exercise and being aware of your environment and taking care of the things like your vision and your medication. But we're going to talk about exercise, and Maria is going to give us a lot of information on that.
Okay, so we talked about muscle strength, muscle power, flexibility, balance. So this is all part of the components of fall prevention. So the importance of preventing falls, we identify barriers to exercise, what exercise are best suited for fall prevention, and creating a daily exercise routine. So those are the things we're going to talk about it. Okay, move on in. Okay. So a weak core can undermine the motions that we are part of our everyday life, motions. So Kayleen Collins, a physical therapist, says that, and it's important. I always in my class, I talk about holding the core. So the core is those muscles that's in front of in our belly, that area, and supports our spine. So as much as we can strengthen those muscles, and we use those muscles for a lot of activities in our daily life. So we talk about that all the time. So that's one of the things for fall prevention as well. Safe tips for exercise. Don't hold in your breath during strength exercise. Use safe equipment. Like if you're going for a bike ride, make sure you have a helmet. If you're going to walk, you're not steady, so make sure you have a walking stick. Drink plenty of fluid during physical activity. That dehydration can cause dizziness and leading to a fall. I talk about that all the time. Drinking, it's all day long. Got to drink a lot of water. Warm up your muscles before exercise. What I do in my class, we dance so we can warm up our bones, our muscles, our bodies. So that's a good thing. So those are some of the tips. And the next one, ways to be active. This is the 4 exercise, endurance. So endurance is pretty much your cardio. So trying to build up 30 minutes of safe activity makes your breath hard most days of the week, like walking, dancing, biking. Those are the things we talk about it. That is your endurance. Build your strength on your lungs. This is part of the fall prevention. So the next one is strength, exercise that build muscle. Even though as we age, we lose muscle, but it can regain by exercise. And we talked about strength versus power. So that like my class, I do a strength exercise, you're using weights. Very, very important to use weights to build strength. And then balance, we do simple exercise to improve balance. It just point, one leg up. I do balancing mobility on Mondays. So in that class, we teach a lot about doing several exercises for balance. Join a class is more fun than doing it on your own, but you can do some of those in your own in a safety environment, like a holding in a kitchen counter or maybe in a bathroom. So one leg up, standing, count to 10, switch. So those are the things we teach in my class. Very, very important balance. Flexibility, stretching. I do some of that in my classes as well. Stretching can improve your flexibility. So yoga or stretch classes, we have a free class on Wednesday for stretch classes, so you can join us for that. Make a habit. Your body will thank you for. So flexibility is another component. Okay, so let's talk about mindset. Mindset, some people call it attitude, belief, demeanor, disposition, frame of mind, mental state. So what that relate to fall prevention? So relationship between fall prevention and mindset is very critical, okay? Especially for older adults or individuals with a high risk of falling. Positive and proactive mindset can reduce your likelihood of falls, while negative and fearful attitude can increase the risk. So here is some just examples, okay, how that is connected. I talked about that before. Is a vicious cycle because fear, when you fall, is if you never fall before, it's a big shock to your body, and people most of the time become very fearful. So confidence and fear of falling. So a positive mindset, individuals with positive mindset tend to be more confident in their physical abilities. This confidence encourage them to stay active, maintain good posture. I talk about good posture all the time in our classes, engage in physical exercise, balance exercise. So very critical. So if you have a negative mindset, so if you have a fear of falling, you might become overly cautious or even avoid activities that are important for maintaining strength and balance. So this can also lead to muscle weakness, reduced coordination, and ultimately the risk of falls. So then also the attitude towards exercise and physical activity. This is just another example. I'm going to give you one more example. A positive mind. People with a growth mindset are more likely to view exercise as a viable tool to improve balance and strength. They are more inclined to adhere to a regular exercise routine, which is a proven method of falls prevention. If you have a negative mindset, those fixed mindset might believe that their physical condition cannot improve. So I said, hey, I've done it before, and I cannot do it anymore. I'm 80 something, I'm done. That's not true. So you cannot improve, or that they are too old or frail to exercise. That's the thing that I hear all the time. Oh, I'm too old now. It's too late for me. So this is a negative mindset. So this belief can lead to inactivity, which increases the risk of fall. So my recommendations are keep a positive mindset about a fall prevention and how can you prevent that, okay? So this is some tips, okay? This is I do for myself. This is something that I do. Mindset tips to help to achieve success and reach your goals. Start the day with a positive affirmation. I do that every single day. Okay, I get up in the morning, before I get out of bed, I do a positive affirmation. Set small goals for yourself out of the day. So don't beat up yourself if things change, your schedule changes. So take time each day to focus on the good things you have accomplished that day. I do a gratitude journal. Every day I write it down what I'm grateful for my day, what happened to that day, what I'm grateful for. So adopted a habit writing down things that you're grateful for. Like I said, gratitude brings more gratitude and bring happiness and bring a positive mindset. So this is my tips for you.
So on top of that, when we started our fall prevention, there was discussion about assertive communication. It's like, well, where does that fit in fall prevention? But the more we've gotten into this, the more we understand that assertive communication is just absolutely a core communication skill, especially when you're speaking with your families or your primary care physicians or anybody, when you are trying to convey your beliefs and your mindset. What do you want for your life? And so it's really, really important because as you are probably navigating the hospital and the medical field these days, you really have to have assertive communications. You don't have to be angry or mad. You just have to say, well, this isn't working, so can we think about a different way to do it? Or, hey, I really like that. Can we continue that method of treatment? It's really helping me. Or, hey, what do you think about this medication? And it's really true to have those conversations with a variety of people within the medical field and even with your family as well, so that you may just be getting take in the information and then go back to your mindset and figure out what your point of view is. And just be free to express that. Your doctor wants to know that. Your physical therapist wants to know that. What are your goals here? Are you willing to put in the time? If you come to me for PT, are you willing to put in the time after PT on the days you're not seeing me? Because, and I want your physical therapist to be assertive as well and say, you're going to get much better if you do this on a regular basis. And if both parties are having constructive, respectful communication, your medical outlook is going to be a whole lot better. And then your mindset is going to actually be a lot better. So we're going to talk about other risk factors now. Is this mine or yours, Katie?
I'm happy to take this one over. We definitely look at medications as a part of your comprehensive fall risk profile. Medication use is rampant in everybody, and especially as we get older. 81% of older adults use at least one prescription drug. 49% use at least one dietary supplement, and 29% of older adults use at least 5 prescription medications concurrently with non-prescription drugs. It's absolutely imperative, like Ann said previously, that you talk to your doctor about all of the drugs you're taking over the counter and prescription, because they can have different side effects in combination with each other. Some of those side effects can be lightheadedness, drops in blood pressure, changes in your vestibular system, neuropathy, muscle weakness. I mean, there are so many things that medications can do that can contribute to your risk for falls. An annual eye exam is really, really important. Of those 3 systems that contribute to our recognition of where we are in space and our ability to balance, vision is the one we rely on the most as adults. I saw a message up there in the chat about bifocals and trifocals versus single vision glasses. It makes a huge difference. If you're outside and you've got bifocals or trifocals, you've got a really altered depth perception, which is really challenging on uneven ground. So talk to your eye doctor about challenges that you're having with your current prescription. A lot of people I've talked to are like, my glasses are okay. I haven't had a checkup in a few years. You want your glasses to be better than okay. We absolutely rely on our vision more than any other sense to know where we are in space. New research is also talking about the importance of a hearing exam. So we know that there's a correlation between loss of hearing and dementia. That's a fact. We also are beginning to learn that people with hearing loss are more likely to have balance problems. So your vestibular system is related to your inner ear. And if there's a problem with your ear, it could be affecting both your hearing and your sensory system that tells you whether you're spinning, whether you're accelerating or decelerating, and what position your head is in. So if you're having hearing loss and you haven't addressed it yet, now's the time, because it's not just going to contribute to your participation in socialization, your memory and your thought processing speed, but it also probably is going to contribute to your balance as well.
Yeah, I think so much. It's very interesting to watch all the new research coming out where, that hearing dementia, we knew, and then hearing and falls. I mean, it's just very interesting to see how much all these systems tie together, and we really can't operate without, it's very hard to operate if they're not firing well.
That's right.
I think that we have footwear.
Footwear, yeah, we've talked a little bit about footwear already. So I did put in the chat just a brief summary of an article that I found. I didn't vet it, for being a very reputable article, so take it with a grain of salt. But I think it's hard to recommend a specific kind of shoe for people that will reduce your risk of falls, because everybody has different foot structures. So if you have neuropathy, we definitely know we need a bigger toe box, because we're at risk for skin breakdown. That has less to do with falling and more to do with skin health. Some people do really well with lower profile shoes. Some people need that heel height just a little bit for other foot problems they might have, like heel spurs. So there's no one solution, but we know for a fact that people tend to trip over shoes that are looser fitting, or they don't have a heel on them. So flip-flops, slippers that don't have a heel are more likely to trip you. Shoes that don't have a good non-slip surface on the bottom, you're more likely to slip if there's water on the floor. So we're looking for something with a heel, with good traction, that fits your foot well, whether it's, larger toe box, lower profile, all of those things are a little more individual.
So let's, before we go to hydration, somebody's asking, I don't know if where do we find this zero shoe? What is it called? Zero.
I think it's something like that. If you're really, I would not order that online unless you're going to go to Zappos and order like 8 pairs of shoes and try them all on. If you're really, really conscientious about what's going to fit, go to a running store or something like that and go try on like 12 pairs of shoes till you figure out what's really going to work. Because the one that looks like the one you want, then you put it on, you go, oh no. So I think that I'm not sure where the zero drop shoe is, but I think if it's that good a shoe, your place like Running Hub or some of the running places should have it.
I agree. And go talk to a professional who deals with shoes all day long.
Yeah. And try those on first before you buy them, because you buy them online, sometimes it's hard to return them, depend on where you get them. Okay, so moving on to hydration, the 8 glasses a day. I try now. I drink, I don't try anymore. I drink about 2 liters a day of water. So I don't know how many ounces are those. So I usually do like when I get up in the morning, the first thing before I drink coffee, I drink a big glass of water. That's about 500 ml of water. Maybe what is it? I don't know, 2 cups, I'm not sure. So then I start drinking during the day, I drink more water as we go, and I drink tea. So as we age, that sense of thirst diminishes. So even when our body needs to be replenished with water, you might not realize it. So that's why I keep it visible, the water, so I remember to drink it. Persistent hydration that causes difficulty walking, confusion, rapid heart rate, or other more severe symptoms can lead to seniors in the hospital. So you don't have to drink just water, just mix it up, do tea, as long as you don't have sugar, too much sugar also is not good. So just remind yourself, put a big jar of water in every time you come by, got a glass and drink it. So just very, very important to hydrate, especially when you do exercise, because you lose hydration, and it's really, really important. Okay, what else, Ann? Okay.
Home safety. Okay, here we go. So also, we'll have this checklist up tomorrow on our site. If you'll go to the first blog, it'll be fall prevention. We'll have the different risk assessments plus this information. So basically clear the clutter, light it up, hold the rails, cut the skids, toss the throw rugs, and move it where you use it. So one of the things that we really emphasize, like in your kitchen, and we were talking earlier about moving and to one side and then not being able to move properly. But also if you're using your coffee pot, but you keep it way up high, or your coffee is way up high, and you're using it every day, move it down and move it where you use it. It's going to be a whole lot easier. We're going to talk about different things like lighting things up with motion detector lights. They're much easier to put up these days. They're much more efficient. Clear the clutter, leave the papers. Maybe get a basket, put your papers in a basket, because it's very easy to slip on papers. Throw rugs, extension cords, all of those things. So you can take this list and just walk through your house. I just suggest that. And just, are they in good shape? Yes or no? Are there handrails on the sideway, on the stairwell? Look in your bathroom. I mean, for example, the towel rack is not a grab bar. Go ahead and get those installed if you need those. We're just really, I think as Katie mentioned earlier, so many falls do happen in the bathroom. So I talk about gadgets because I'm kind of a gadget freak. I use a lot of motion detector lights. This image right here of the door, as you walk up it from my garage, I mean, obviously the garage door light goes on, but it's not very bright. So when I walk up, I have a small step, and down below on the right-hand side, I have a small light that turns on, and then there's another light right before the door itself. I also use those small round lights. They come in packages from Amazon. I think I got 6 of them for $15 last time. And they run off of 3 AAA batteries. They're LED lights, so the batteries last between 6 and 8 months. And they have both a magnetic and a sticky back. So on my stairwell, I have them going up the stairs. So as you walk up the stairs, you don't have to turn on the big light overhead. You can just go up the stairs and it lights up the stairs as you go up. You can put them anywhere. You can put them in your bathroom. You can put them in your closet, just any place, so that when you're walking around at night, especially, you are having a reasonably lit situation without having to turn on major lights and wake people up or wake the dog up or whatever it is. But it really is helpful. This bed light is very interesting. It is a long strip that has adhesive on the other side, and you just run it underneath your bed frame, and it plugs in, and it has a motion sensor. So if you have to get up at the middle in the night, depending on where you put the motion sensor, you can put it on like your nightstand or under your bed. It'll turn the light on for between 30 and 60 seconds. You can time it for that. And it's a very low level light so that you're not disturbing anybody, but you can see if you're going to get up. So all of these are available on Amazon. You can just go to Amazon and search on motion detector lights, and you're going to get 1,000 different options. And just depends on how much light you want from it, if you want it to be electric or battery. I do both in the bathrooms. I do plug-ins on the stairwell. It's much easier to do battery. But all of these things just make walking around when it gets dark much easier. And then we talked about our trekking poles. These are nice. I keep those in my car because here in Santa Fe, we have some, the idea that we're supposed to be an age-friendly city is really interesting because we have some sidewalks that just are virtually nothing. So it's really nice. And right now we don't have any snow or ice, but frequently we get snow and ice. And it's nice to have something to be able to give yourself an extra little, a little extra point of contact to the ground. Somebody mentioned earlier about their crampons, I believe, that they were having trouble with the ice. Just a second. Boots. Yeah, no, boots I've not found any boots that are really slip resistant. I have some really good treads on boots. I have boots from Canada that have good treads, but they're not the same as putting cleats on the bottom. And so you can buy the I'm trying to remember the name of them. Katie, you think of them? The Yak Tracks. And they're about $20 and they can clip on your boots. And I actually have a pair on my boots so that if it is snowy, I don't have to stop and put them on. I can just go out and get the paper or go out and get the mail. So that's pretty cool. Now, the other thing is many of us live alone, and falling and not being able to get help, or not being able, you're just falling and nobody knows you've fallen, is really a serious concern. So the Apple Watch does have fall detection. Unfortunately, you do have to have an Apple Watch and an iPhone to make this work, but it does have a function that if you fall, it will come up with a notification. You can see this SOS emergency call. It'll also vibrate. And if you can say, I'm okay. Or if you don't respond, it's going to call 911. It is also going to call people that are on your medical program on your iPhone that are medical contacts. So somehow my phone decided I had fallen earlier that last year when I was up in Portland, and it called Maria, it called my son-in-law, it called my daughter, it called my best friend in Houston, and I had to call them all and say, first I had to call 911 and say I didn't fall, so I didn't have the police or the fire show up. And then, so it does happen occasionally, but it is really important. I had a friend fall and slide literally underneath her car in the ice, and she had her watch on, and it did call, and they did send out the emergency people to help her. So I really, if you don't have, and if you have an iWatch, if you have an iPhone, I would really consider getting the Apple Watch as a really important medical device, just for the safety, because honestly, we're going to wear that watch versus the clunky thing around your neck. And it really does work. And there are various things we can show you how to make it work. Even if you fall and it doesn't, or you have an emergency, you can also call 911 without having to have your phone with you.
Yeah. So, and another thing that we talk to people all the time is, remember, keep the phone with you, especially if you by yourself, you're doing yard work or anything. Just keep the phone with you so you can call somebody. I hear all the time people had a fall in the backyard, tripped in a garden hose, and was down for over a couple of hours, especially if it's a bad weather, overheat. So make sure that you have that. Also, dog leashes. When you walk your dog, pay attention to that dog leash. There are a lot of falls happen because people just got tripped, and then dog run in front of them and don't have time to, if you lose your balance, you don't have time to recover. So pay attention to the dog. And also in the bedroom, that light really helps to light up the floor. If the dog's not in bed with you, a lot of people have the dog's in a bed, but some dogs are on the floor. We hear all the time people have falls because of that. So just a reminder. Okay.
So again, what to do when you fall? Stay calm, be assertive. Take the time to assess the situation, even if you're in the middle of the street. The worst thing is to try to jump up and get out, and then you're dizzy, you fall again, or somebody tries to lift you up and they hurt you or they hurt themselves. Check for injuries, breaks, sprains, blood. Take a breath. Just breathe. Did you hit your head? Did you lose consciousness? Go ahead and call 911. These are great. The EMS people are great. They're going to help you assess the situation. You have the option to go to the hospital or not. That's up to you. But we would encourage you, as Katie talked about TBI, it's really important to assess your situation. And if you need medical assessment, go ahead and do it. So we've had a great time. We'd love to hear from you if you have some questions. I think Katie has a couple minutes before she has to run off to a patient, but we'd love to see you at classes here with Villages of Santa Fe. And you can log on to our site and sign up. We have free classes multiple times a week.